Assalamu alaikum. In the last video, I will discuss about the definition and some common symptoms of Marfan syndrome in it. And in this video, I will discuss about the abnormalities that Marfan syndrome can occur. First of all, we will discuss about the skeletal abnormalities. Weakened connective tissues can cause bone to grow longer than normal ligament. As we can see in the picture, the normal hand has short fingers with a normal stature. But in the Marfan syndrome, the person suffering from elongated fingers and arm bones. This is because the person can lose elasticity in their connective tissues. It also affects the ligament tissues and make it loose and more flexible. Difference in bones and joints are some of the more obvious signs of Marfan syndrome. As we can see in the last video, most of the person has abnormal stature and abnormal body parts due to loss of elasticity in their body. Therefore, most of the persons can suffering from elongated parts of body other than normal persons. Ligament act like a strong rope to hold your body together and keep your joints stable. Ligament perform an important function to maintain our stable body parts and joints, but due to loss of elasticity, the ligament cannot perform their normal function in Marfan syndrome. It can also cause the chest abnormalities in the person that suffering from Marfan syndrome. Marfan syndrome can interfere with the normal development of the ribs, which can cause the breastbone to either protrude. Protrude means extend behind the original surface which is present the normal chest cavity, or appear sunken in the chest. Sunken means the concave shape of the lungs. As we can see in the picture, two persons can suffering from Marfan syndrome, and one has the breastbone to either protrude and the other has sunken in the chest cavity. Sunken means concave shaped formation in the chest cavity. Now we can study the ocular changes that occur in Marfan syndrome. In ocular changes, most of the person have flattened cornea. Flattened cornea, as we seen in the picture, that the person has flattened cornea and they cannot see the person with clear vision, because cornea can perform an important function for the clear vision of an person or eyes. Glaucoma, that damages the optic nerve which is vital for good vision. Strabismus, people cannot align both eyes simultaneously under normal condition. As we can see in the pictures, the eye changes abnormalities occur in the Marfan syndrome. In the right side picture, we can see the symptoms of glaucoma, in which the optic nerve damage because of the pressure provided in the eyes. Optic nerve can perform an important function for our vision. When optic nerve is affected, the person cannot see the vision properly. And in the left side picture, it can show the symptoms of strabismus, in which the person cannot align the both eyes together. As we can see in the cardiovascular abnormalities are very severe abnormalities that occur in the Marfan syndrome. In cardiovascular abnormalities, adults with the Marfan syndromes have abnormal cardiovascular system. This is because the person suffering from dilated aorta. Most of the children with Marfan syndrome have aortic dilated. As in the Marfan syndrome, the aorta of the person has dilated, and just like seen in the diagram, the normal aorta and the abnormal aorta as seen in the diagram have dilated in Marfan syndrome person. The treatment of Marfan syndromes are aortic repair, curved spine treatment, eye surgeries, and breastbone correction. Now we can see some chart of Marfan syndrome. As the summary of Marfan syndrome I can see at the end. First of all, we can see the effects of Marfan syndrome. As we can discuss in it, that they can affect the head, eyes, skeleton and heart, as we can discuss in detail in our video. The symptoms of Marfan syndromes are being very tall, slender, having heart problems when your chest growing inward. Treatments of Marfan syndromes are daily checkup, medication and surgery. Discovery of Marfan syndrome. Antoine Marfan discovered the disorder in 1896. This is all important for our MCQs and some additional questions. Thanks for watching and keep subscribed for more educational video.